Okay, thank you for inviting me. Bev gave me a call. I just got back from Toronto on Friday, and Bev phoned me Saturday, and I wasn't too sure what the whole topic was today, but I can go on and on about healthcare because I've been involved for many years. Before I get started, I just want to remind you of the principles of the Canada Health Act. Public administration, which would preclude the present board, I think. Comprehensiveness, universality, portability, and accessibility. And I doubt any of those are being adhered to very well. As was mentioned, I'm a retired registered nurse. I'm now a senior citizen. I also have a mother who is 92 years old and a senior citizen, so we got the full spectrum here. I have been a recent patient in the healthcare system, and mother is currently living in a long-term care facility. She was in a lodge. She has lived in a senior citizen apartment building. Right now in the long-term care facility, she's paying $47 a day on her income, plus paying for laundry, plus her hairdos, some of her medications, and because she's lonely, I pay for someone to go in and visit her more often than I can be there. Our healthcare system, I do believe, should be renamed. We need to delete the word care. We need to replace the word system with industry. We need to get rid of the word health and replace it with, oh, I don't know, human anatomical, so we have a human anatomical industry. Or some people want us to have a punitive kind of healthcare industry where you don't get services if you don't live a lifestyle that's absolutely perfect, which is very few of us. Talking about hiring freezes, appears to me the government, I have to go back. I was thinking today, I remember when Ralph Klein first started making cuts. He said he'd heard from, who's that guy, Rogers in Australia, hit him hard, hit him fast, and don't blink. And I still see that activity going on. The only time I ever knew of Ralph blinking was when he got a pie in the face. But anyway, to get on with the staffing of hospitals, and I know this mostly from a nursing perspective. The nurses that are being trained now, I think, are being trained not to be nurses, but nursing technicians, and rather than care workers. But they are licensed. There is a licensing body. LPNs also have a licensing body, but the people they seem to want to hire, who they can overwork, pay the lowest salary to, aren't necessarily trained at all. Some are, some aren't. They can be brought in off the street, which in fact is exactly what Florence Nightingale was fighting against, 150 years ago. These PCAs or health aides or whatever title they give them, there are courses and classes, but they're not necessarily required. And they're all very fine people. They're looking after mother where she is now, and they're all very, very nice people, caring people, but they're overworked, underpaid, and could do a better job if there were more of them. So we don't need a hiring freeze. We need more staff to provide care. And care is what people go into hospitals and facilities or even outpatient for, is care. That's what it's all about, is care. In my own case, I had to spend some time in hospital for major surgery, and I'm not going to give you all my health history, but last summer, and it seemed that once I was out of the OR, the whole goal of treatment was to get me out of that hospital as fast as they possibly could. I was not allowed to be adequately hydrated. I was off IVs too soon. Let's just get you out of here. Get you eating before your peristalsis is reestablished. That's all they wanted to do, get me out. I was told that I shouldn't be using stairs. Well, my house is stairs. Oh well, I guess that's the case. You're going home by yourself? Yeah. Oh, you shouldn't be. Somebody said something about home care, but there was no discharge nurse. Anyway, I have lovely friends, lots and lots of lovely friends, so that turned out not to be a problem. But it was a horrible experience. And at this time, mother started failing really, really, really badly. We had just recently moved her to a lodge, and she wasn't really complying with some of their rules. I didn't know what to do. I was too ill. It was too hard. This is when you're sick, things are just too hard. And if you've not been there, if you've been there, you know what I'm talking about, and if you've not, trust me. Sometimes just making a phone call and being put on hold is just too hard. And I was in that case, and I'm getting all this hassle about having to move mother and get home care nurses in and do things for mother, and it was just horrible. Mother got bad treatment in the lodge. She was very confused. She was losing her vision, walking around one evening after supper, and she would have had a home care nurse coming in soon to put her to bed, but she was bothering somebody, so they loaded her into an ambulance, sent her off to the hospital, and then she got brought back. And she said to me the next day, "What's going on? I don't understand. I don't understand. I was just walking around and they sent me to the hospital. What's going on? I don't understand." That's a very unkind thing to do to a confused, blind old lady. That was a horrible, horrible thing to do to her. So I just think things going down, 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 down. And as far as the labs being moved, error, error, error. Repeat lab work and losing things, mix up, confusion. It's just stupid, plain stupid. And that, I'm afraid, is all I have to say.